neuroinflammation, which seems to be in large respect a result of some sort of imbalance that's causing inflammation within the gut, that then the body seeks balance. Like, that is all it really cares about. Like, it wants a balanced temperature, it wants a balanced pH, it wants everything to always be within a fairly tightly controlled balance.
Doing a hard reset on this one system allow us to send out the right instructions to multiple other systems. And that's kind of where the idea of targeting the gut microbiome through fecal microbiota transplantation, or FMT, comes in.
A patient that I saw years ago, and back then we were just doing FMT treatment via enema. Now it's improved quite significantly, where we have oral treatment options. And so I think had I treated that same patient today, we probably would have gotten an even better outcome.
Hi, everybody. Welcome to another exciting episode of Biome Breakthroughs. And today we're jumping into a topic that is actually something that I've noticed has come up more when talking with practitioners, or when talking about kind of what people have seen or heard about FMT being used in outside of C. diff, where the research is going, or where there's a real kind of cry for research. And a number of times we've talked about neurological conditions being tied back to the gut. And I don't know if we talk more about that because I'm a neuroscientist and I like brain stuff, or if you really look at what we don't understand and where we're lacking, I think, in treatment, a lot of it falls back to neurological conditions that definitely have some systematic or systemic presentation as well. And so when we're talking about those kinds of things like Parkinson's, that has some kind of motor function as well. But today, we're going to talk about multiple sclerosis, or more commonly tied MS, which also it's a fun one in the terms that it's definitely a neurological condition, but it's also an autoimmune disease. It also has some kind of systemic presentation as well. So I find it doesn't fit as neatly into a box as other conditions do, where you're like, this is a brain one and it does brain stuff, and this is a body one, because it has such an inflammation and autoimmune based issues. But those are tied then to some of the neurological as well as the motor presentation. And so for anyone that's not really sure what multiple sclerosis is, it's a chronic inflammatory disease that also has a neurodegenerative component. And most of this is with demyelinating of the neurons. And so basically all of your neurons are wrapped in little blankets of happiness that allow signals to happen really quickly. And basically, like, you want a signal to go from the front of your brain to the back of your brain without even knowing it happened. And part of this is allowed by the fact that they're myelinated. So signals can jump across these, so they don't have to go the whole way down a neuron. And neurons in your head, you think they would be small because your brain's really not that big. But there's a lot of them, and they actually are quite long, and they connect in odd ways. When these myelinations start to kind of degrade, basically signals can't jump anymore. So they start going slower and slower. And part of this, not only is the signal moving slower, it actually degrades while it's happening because they weren't set up to go that distance. So that's where the CNS, or the central nervous system component, is. But there's also immune dysregulation, there's issues in the blood-brain barrier, and then there is dysfunction both in motor function as well as cognition, as well as issues within the GI. So again, I kind of started with this. It's a little bit of everything. It's kind of hitting everywhere. And we don't really know where it starts. And how we define MS, I think, is much later into the disease. I think when we're looking for signal degradation and myelination to be affected, well, that's late stage into this, because reversing that, I want to say, is near impossible. So what do we do before, and what are the early signs? And there is a big role, shocking to no one listening, that the gut microbiome, we think, is involved. And we were talking about this, is like, in a lot of these neurological conditions, we keep saying the same things. The gut microbiome, the composition, diversity is different. There is a large, consistent kind of dysbiosis within the gut. There is a reduction in short-chain fatty acid producing bacteria, which again is something we commonly see in these neurological conditions, as well as the bacteria that are associated with having more inflammation are higher. So the gut profile, and Jason, you were saying this when we were chatting before we started recording, like that seems pretty consistent. Like you read it a couple of times if you're reading our blogs.
Yeah, it just, the more that we dig into and these individual topics that are around, neurological disease, this progressive, demyelinating conditions. We've talked about Parkinson's before. We've done a lot on the topic of autism, which of course is different, but it's still classified as a neurological disease. And the thread between all of these conditions or diagnoses is, this neuroinflammation, which seems to be in large respect a result of some sort of imbalance that's causing inflammation within the gut that then somehow, through the vagus nerve or just through the broad release of toxins getting into the brain and creating a disrupted, neurological response and sort of inflammatory response in the brain as well. And so it's an interesting, sort of observation as we see these. And the natural, sort of takeaway from it that I had was like, well, if the gut is associated with all of these conditions, what could we be doing much more proactively? Like, if you're a physician and you have a patient who's, say, in their 40s or 50s and they have a family history of, neurological diseases, whether it's Alzheimer's or Parkinson's or dementia, what could be done early to then decide whether or not we need to be more aggressive about the interventions for this type of a patient profile? And so what testing could be done? Looking at their microbiome, looking at zonulin or other factors of leaky gut, looking at, whether there's inflammation broadly in the body. It's harder to detect at these very low levels if we're early, but oftentimes these digestive symptoms, even broadly just IBS, precede by many years the later diagnosis. And I've heard this time and time again from patients. They'll always say, this started at X point and it was with something that happened to them. They were, some food poisoning, or they got really ill with pneumonia and had to go on hardcore antibiotics. And then ever since then, they had IBS. And the story just builds from there. So in many cases, the gut is really a key driver of this inflammatory reaction that then potentially, based on genetics or some other environmental factors, is more likely to affect certain demographics, maybe women in more cases, or certain families in more cases. So there are other factors that set this up to increase the impact that it might have on an individual. But beneath all of that, there's these core drivers that are affected by this inflammation that starts within the gut.
Yeah. And, MS is more prevalent in women, similarly Alzheimer's disease. And so a lot of these conditions, there are just risk factors that exist. But the other is, and I think you hit on something really key here, is that could we be looking a little bit earlier? And again, is the gut, the leaky gut playing a role here? So is the intestinal barrier being impacted and becoming impaired, be that through the general dysbiosis or the setup of the way that the gut microbiome isn't really supporting that in people that are at higher risk. And then that then leads to higher levels of systematic inflammation, which then can activate the microglia in the CNS. And, we know that the gut and brain are tied, and we've talked about this, especially in neurodevelopmental disorders where, the gut isn't reaching its milestones, which impacts the brain meeting its milestones. But is the same happening in that the gut is sending out signals when it's become too permeable? So the intestinal barrier has changed and shifted. And we know that the intestinal kind of junctions are very similar to the blood-brain barrier junctions, and this also being impacted. And this is where we're seeing things that shouldn't be getting in, and not only activating the brain's immune system, which is that microglia activation, but also putting things in that the brain is not prepared to deal with. It is a very tightly knit system. It works, hope streams and a lot of science, but it doesn't like being shook. It doesn't like the things to change. That's how the brain works. It likes the way it works. It is separated for purpose. But if that degrades, is this where we're starting to see these things? And then how do we look for the gut barrier degrading early enough that it's not signaling other systems to degrade? Because we know that the gut is tied to so many systems. And, we're focusing on the brain right now, but, last week we talked about SIBO and how that impacts the gut, kind of the gut system breaking down. How do we see that earlier? What's the first thing that we could be stopping and restoring before we get to the point where multiple systems are involved and multiple systems aren't working and inflammation is so high that everything is just like on red?
I think a big part of it that we're touching on but haven't really got into is the effect of that inflammation over an extended period of time on the immune system. And so the imbalance and this neuroimmune connection and neuroinflammation as a part of this immune dysregulation and the effect that that's having on the brain, and then ultimately this degradation of these myelin sheaths. So I think that's likely a big driver of this impaired or imbalanced immune response as a result of, again, there's multiple factors that could affect this dysregulation and imbalance of this T regulatory response. Like, it's curious that the more that we're doing this, the body seeks balance. Like, that is all it really cares about. Like, it wants a balanced temperature. It wants a balanced pH. It wants everything to always be within a fairly tightly controlled balance. And if that balance is shifted for a short term, it can usually get back. But the more that we cause an imbalance, or some environmental factor causes an imbalance in one system, it can tend to overreact. And we see this even with cold, right? Like if you become too cold for too long, the body just gets confused and it can't figure out how to get back, and it becomes dehydrated and all this stuff starts happening because it's overreacting. It's like I can't be outside of a very specific range for too long, otherwise the wheels sort of fall off. And so I think this is really happening with the immune system, where if for a short term, you get sick, your immune system is overactive, it does its job, it clears it out, moves on, goes back to being balanced. But if we're forcing the immune system to be imbalanced for too long, it starts to learn, the programming or the learning becomes imbalanced, and then it becomes too overactive in some cases or too underactive in others. And that's the story of the autoimmunity, right? Like, why is the immune system overactive against its own cells? Like, clearly that, the immune cells that went to university mixed it up and they got it wrong. But how do we get it back? And I think the microbiome and the imbalance that is started there creates this, dysfunction in this learning process of these immune cells. And so that over a longer period of time, you just have too many of these cells graduating that don't know what they're doing. And how do we get it back again? And that's the hard part. And a lot of that will, of course, come down to reestablishing balance in some of these foundational areas of our health, which of course include our gut and our microbiome, to be able to retrain the immune system to act in a more judicious way. Don't be overactive, don't be underactive, be balanced.
Yeah, and we talk about this a lot, but the gut microbiome plays a huge role in the immune system and the immune regulation, which is like 70% of the immune system is regulated through the gut. And specifically in a neurological condition like MS, this regulation of the immune system can then influence through the gut-brain axis the, microglia activation, interleukin, in general, the signaling within the CNS for inflammation, because they have a direct, telephone line between each other. And when the gut doesn't have any instructions or has all of the wrong instructions, it's still running the show. It's still telling everybody what to do. It just doesn't know what it's telling, or telling the right thing, the wrong things to be off and the wrong things to be on. And you do that over and over again. And at some point, you don't even remember what the right instructions were. And then this inflammation can be tied to the damage, right? Like this microbiome dysbiosis, and it's tied into MS pathology, is this kind of, incorrect immune activation leading to CNS inflammation changes in permeability within the gut and possibly the blood-brain barrier, the wrong types of signaling going out, not having enough or having the wrong types, having too much pro-inflammatory, not enough, anti-inflammatory, as well as not having the right kind of setup to build the right building blocks to ensure you are able to turn off and on the right things. And all of this imbalance keeps making more inflammation and then more damage. And in the case of someone with MS, it becomes to a point where multiple systems are dysregulated. And you see that in the late stage pathology, because it's not only that their immune system's on and they have a lot of inflammation, but now cognition is being impacted, memory is being impacted, the ability to walk and their gait gets shifted. And part of that is signaling. Part of it is miscommunication within systems. But that is that constant slow kind of rolling snowball. Clearly it snowed here. That all I can think about is snow. But it keeps adding. More systems go offline, more symptoms come about. And not to say that the gut microbiome causes MS, but there's definitely a tie there. And it could be that there's some underlying kind of instructions genetically that allow kind of the beginning of that snowball to lead where we're going. But consistently, the gut is tied back to both the beginning, the middle, and the end of the disease. So if you're going to look somewhere to go, could changing this help? Could giving the right instructions, doing a hard reset on this one system, allow us to send out the right instructions to multiple other systems? And that's kind of where the idea of targeting the gut microbiome through fecal microbiota transplantation, or FMT, comes in. And we talk about this a lot, where it's somebody with C. diff had a disease and they got FMT and then something unexpected happened. And the same story is true in our kind of those initial MS studies. And there are kind of 4 pinnacle ones that have happened, and they kind of range in time. But most of these start initially as a case study. And the first one is a case study of someone with C. diff who got FMT, but already had MS. And then, people trying to build on that to see, was it just that person? Did the C. diff play a role and solving that fixed it? Or is it an MS-based thing? And if you're familiar with this space, Dr. Brody is one of those names where he's kind of been a little bit everywhere. He's done a little bit of everything. And his name comes up pretty much in every area, which is, as a researcher, is very impressive that the same person who talked about, ulcerative colitis many moons ago in that space is also writing papers on MS. So my hat is off to him. But I read that this paper a very long time ago. It's from 2011 and it's not new. And I read it and went, this seems unbelievable. 3 different people at 3 different stages within MS, ranging from somebody in a wheelchair to someone on early stage. And all of them got FMT. And the improvements across their gait, spasticity, their bladder control, which was why most of them, the GI issues, so constipation or bladder issues, were why they had sought doing FMT. But the improvements in their gait were outstanding. To the person who had been using a wheelchair, was not wheelchair bound, but was using the wheelchair because the gait issues had gone so far, was up and walking. And because this was a case study, you look long lasting. So these results range from 2 to 15 years later were maintained.
It's unreal. And I think, I wanted to call this out a little earlier as well. Like, I'm imploring, if you're a physician or even if you're a patient who's early in the diagnosis of this, to be more aggressive early. If I had any, observation over my years of treating people with neurological diseases, it's that I wish they had come to me sooner. I wish that they didn't wait until they were wheelchair bound to seek out these types of interventions, because I think it would have totally shifted the progression of their disease. And, this is a little forward. But I do believe that if we can address this early, we could totally stop the progression of these neurological diseases if we do it early enough. If we wait until it's fully progressed, I think our best hope is slowing down the progression, maybe stopping the progression, but not necessarily totally reversing the disease. I think if it's too progressed, the damage is too severe, and to come back from it is that's a tall order. I'm not saying impossible, but a tall order. So I think, my message would be try to do these early interventions in the early stages, even if they're early onset of the diagnosis. Don't wait until it's more progressed to do something that would, and I understand it, like people would assume FMT as being more, sort of like considered invasive or a procedure that you would wait until the other standard therapies might have been tried or exhausted or didn't work anymore. But that really would have been my hope for patients that I would come across, was what would have happened if we could have treated this before they were in the wheelchair, when they had the early signs or symptoms of sort of maybe musculature effects or some of the neurological effects. What would have happened for those patients had we intervened early? And I do think in some of these cases, not necessarily all, it would have been possible to totally stop and potentially reverse the disease had this been addressed on time.
Yeah. And I think it's interesting in this area. And I think we've talked about this previously, where we see a shift, especially in these more complex disorders, where treating over a period of time seems to play a really big role. And MS is one of those, even in the early studies, treating over months, and some of that being, intermittently over that time period or across that longer period. But the key here is that with proper screening and with proper manufacturing, the FMT is quite safe in this population, seeing the same kind of adverse effects we see across the board, mild GI, self-limiting. But as well, the improvements are long lasting. So we have studies showing, more controlled studies that are looking at, a year after not having any relapses, and improvements, consistently, not only in the changes of the gut microbiome and GI function, which is like bladder control, issues with the constipation, but as well changes in how the inflammatory profile, immune activation, but then gait and neurological changes, and again, changes in short chain fatty acid and how that impacts, different brain-derived kind of systems, as well as in general quality of life and the status of the disability, which is mostly focused in these studies around gait or spasticity, but improvements there. But consistently, we have 4 kind of studies that I would consider having been laid out well enough that you could say, okay, there was a goal all the way through. Consistently across all 4 of them, long-term improvements, and improvements almost consistently in the same things. That doesn't happen, especially when it's a series of cases, right? There's only 2 of the 4, 2 of them are case series. And that means the application wasn't set up always exactly the same. It doesn't mean that the check-in points were exactly the same, because the idea is these are 3 independent things that all ended up kind of being related. To see across that consistently the same types of improvements, the same long-lasting changes, is really, to me, indicative of that there's some consistency when you can give the right instructions and kind of help reset those systems that have become dysregulated. You consistently see similar improvements. And so for me, MS is very similar to Parkinson's disease in the case that where you're reading it, you're going, it not only makes sense in terms of we know what systems are impacted and what the cascade kind of looks like in terms of the initial kind of what we see as the beginning of where MS would start in late stage. But the results are so compelling that it's like, okay, so clearly there's something here. And in a case where there isn't a lot of other options, should we be asking more questions, and should we be, kind of shouting from the rooftops that, maybe this is part of, if not a key to really understanding this disease, as well as finding a way to consistently treat it.
Yeah, I mean, it is sort of shocking given the amazing outcomes of those studies that there haven't been many more, because a lot of people are affected by this. I mean, it is, there's definitely need to be more both clinical and institutional research on this because there's such a need. So, hey, if you're a practitioner provider out there who has a lot of these types of cases and want to create your own case study around this topic, I think we should talk because this is so consistent. And I'll just reflect on a patient that I saw years ago. And back then, we were just doing FMT treatment via enema. Now it's improved quite significantly where we have oral treatment options. And so I think had I treated that same patient today, we probably would have gotten an even better outcome. But the thing that shifted so quickly and so noticeably for this patient was her anxiety. So she was wheelchair bound, obviously had the motor challenges, and she could still stand them for very brief periods and she would get too tired. But very quickly into the treatment from like day 1 to day 2, her demeanor and the way that she entered the clinic totally shifted. She went from being very anxious, very worried, very concerned about everything to laughing and just being like, I couldn't believe it was the same patient. I mean, it was so shocking, the difference. And just an example of this was, back then I was in collaboration with the team in Mexico, was seeing families and patients there. And they were staying at a place on the beach. And she hadn't touched the ocean or been to the beach in years. Because she was just, she's in a wheelchair. How do you get a wheelchair out to the beach to actually, put your feet in the water? But her shift in her anxiety and her all of her worries and concerns was so changed that I helped her with her family. We got these 2 sheets of plywood and we put one in front of the other. So she'd roll onto one and then she'd roll onto the other, and it was motorized. So she could and she got all the way down to the beach and was able to put her feet in the sand and feel the ocean. And it was such a shift. So that was a real obvious, very quick change. But then also just that improvement in her anxiety persisted as well. So that continued many months. And, I didn't stay in touch with it. This wasn't a case study type thing where I continued to follow up. But at minimum a year later, she was still seeing that same improvement in her anxiety as she had in the very beginning. But then also she was able to stand for much longer. So she was able to take a shower unassisted. Whereas previously she would have needed to be assisted. She could stand for longer periods of time to cook and prepare food, which previously she wasn't able to do. So very, very fascinating. And of course, in hindsight now, I wonder and wish we had the capacity and technology to do the capsule treatment over a longer period of time to see if we could have even gotten further improvements. But in this case, actually speaking of Dr. Brody, I was in a webinar training something where he was presenting, and he said, if you can see it in one patient and it creates this transformative improvement, it's very likely you'll see it again and again and again. And I think that's the case in MS and a lot of these neurological diseases. Like, we're getting this early signal that it's improving, it's shifting, something's changing, and it's happening consistently. At scale, it should do the same thing as well. And so I think MS is one of those areas where there just hasn't been a lot of advancement. None of the drugs are doing anything significant. None of these other even alternative treatments are making really consistent long-term changes like stem cell. There's clearly people who see benefits from that as well. But yeah, so I think there's a huge opportunity here. And, I would implore both physicians who are seeing a lot of these patients and then patients themselves to investigate this further and see if we can't push this field further faster because of these early signals that are consistent and very promising.
Yeah. And I think, from a preventative standpoint, how could the microbiome become a biomarker for these diseases? And then how could it also be, a targeted therapeutic? And, we keep talking about this until we figured it out. But, how do we match the right donor with the right patient so that we can consistently go, oh, this is what your profile is. This is the profile you need to be able to shift that. And we're not there. And I think part of the beauty of FMT is the hammer approach works. Take it all, whole new instruction manual. You will take what you need and you create, your own healthy version of the gut. But, as we get more into the idea of preventative and precision, this, matching donors to patients becomes, what would happen if? do we take, because, in every really kind of upper level therapy, and I think about, immune modulation in oncology, the non-responders, what causes them to be non-responders? And so could we, I think the non-response rate in FMT, depending on the disease, definitely varies, but could we reduce that even happening by understanding the matching better? And I think the more we understand about this in terms of a biomarker as well as a therapeutic, the closer we get to how does this pair with what we're currently doing? Could we be doing this earlier so that we're setting people up to not kind of go down this pathway? And so I think in the case of MS, and I think in other neurodegenerative and neurodevelopmental diseases, we're realizing that they're not just brain diseases. And I think we'll continue to say that about every disease. We're starting to realize it's not just one system that's impacted, because it's not just one symptom. And that one symptom doesn't lead to other ones. And I think they're all tied together. So, as a brain person, it's kind of interesting to think that I don't think there are many diseases that are just brain diseases. The more I learn and the more I think I open my eyes to look at everything that's happening, it's a whole body thing. But we are a whole ecosystem, right? Like, we create one ecosystem, and to think that only one part of it plays a role in a disease, I think is one of the reasons we're shifting away from that, because it doesn't make sense when you look at the signs and the symptoms. And so I think MS is another case where it's not a brain disease, it's a whole body disease. And how do we see it earlier? And how do we treat it as a whole body disease?
I think you're onto something. And even, you were talking about the matching in the context of oncology and some of the drugs that didn't work but now work because their microbiome is upgraded. I mean, that same thing would exist for a lot of other conditions where, physicians have to keep cycling and trying different drugs until they hopefully find something that works. But the interplay of the microbiome in all of these different cases, whether it's the symptom, whether it's the disease, whether it's the drug needed for the disease, I think the future of medicine will really involve FMT and microbiome therapeutics much more than currently, because of our expanding knowledge and understanding of the role that the gut and the microbiome play in the overall progression, severity, and symptoms that are expressed through these different disease and disease pathways. So I know both an exciting time, a time with a lot of opportunity, I think a lot of hope for humankind as far as being able to hopefully prevent and stop the progression and increase in what I think is a pandemic of chronic disease. I mean, it's scary, really. But I think with the emergence of some of these technologies that exist, we're now in probably the best time ever to live as far as our ability to prolong the quality of our lives. And of course, there's this big, biohacking longevity movement where I think FMT fits in really well, and the microbiome therapeutics broadly. But, I'm very excited for what's possible. But it does require both physicians and research to look at the body holistically. And as you said, don't just think about these diseases that have a lot of neurological symptoms as being only in the brain. We need to expand our sort of worldview of including everything. And what's the seed of this? What's causing us to begin with? What are some of these biomarkers that we could track early and deal with much earlier, so it doesn't even go down the path of leading to an expressed and defined disease state like MS or other neurological diseases?
Yeah, and I think we'll keep talking about these topics and trying to piece this puzzle together. And, in a year, we'll talk about MS again, and it'll be a completely new and more in-depth story, because I think people are asking the questions, or we're at the beginning of a really exciting time where everyone, I think, is getting closer to on board with the idea that the gut is playing a role. You can't have something with immune or inflammation issues and not look some point at the gut. And I think that that's why these conversations get more and more exciting. And if you're watching this and you go, I have 10 more questions, or I wish, they got into this, reach out to us. We will already have the answers, or I will go on my merry way and find it. Because the more we learn, the more we talk about this stuff, I think the more people it becomes common knowledge, and it becomes just, that's the way, this just makes sense. And if you have a topic that, you wish we talked about, last week we talked about SIBO because someone asked us to, shoot us an email or comment on the internet that what you would like us to talk about next, because that's, we want to talk about the things that other people are asking questions about. And if you are a physician and you're going, okay, so all of this makes sense, but I'd really like to know more, please reach out to us. We are always willing to, just have a quick chat to kind of get your basic questions answered. Or if you want to talk for an hour about all of this, reach out. We'd love to do that too. And we're always here to answer your questions. And, we want everyone to kind of understand the importance of the gut microbiome and better understand where FMT currently is and where it's going. Because that's kind of, that's our biggest passion.
We're trying to build an army, so to speak, through education to propel medicine and humankind forward faster. Because and this happens. I having spent many years practicing as a naturopathic doctor, we kind of just find ourselves on islands, and we want to recruit and bring together leading doctors and researchers to move this field forward faster. It's happening. And the question is, are you going to join on the ride? Do you want to become a part of this movement to propel medicine forward faster? And I think it's going to be done in clinical practice. It's not just going to be relegated to some department in some university someplace. They have a role, no doubt. But clinical medicine will move this forward much faster. And patient care advocates, are a powerful, powerful force. And so if we all join together, I think we'll move more medicine faster than at any point in human history because of the power as well of technology. So let's do this together. Reach out if we can find a way to support you in your research and treatment of your patients. If you're a patient, talk to your doctor. Share this episode. We need to do this together. And I think this again is just a perfect time in humanity with the combination of these therapeutics that we're learning more about with technology. We can do a lot, but we can't do it all alone. So join us.
And I hope that you're subscribing so you know every time we launch a new episode, because you don't want to miss any of this. It's all very exciting. And please connect with us so that we can kind of answer your questions and get to further this kind of mission along. So thanks for joining us, and we'll see you next time.